Okay, well, we're back here with Squeaky again. I've got a cohort here. Fitz is a veterinary technician. He's going to give me a hand. We're going to do a few things with Squeaky that Squeaky may not like. So he's here to help me out. Great idea to have a helping hand with you at home for anything that you need to do at home. So it's a good idea to have somebody that knows what they're doing around. I've got a couple of things here that I brought up just more as just kind of joking along. This guy. This is, this is kind of the old way of looking at medicine. Big needle, big syringe. It's what I used to use on cattle. So it's not for cats, but think about it. Even a little tiny syringe and needle for a cat may look this big to a cat. Another thing that I use for cattle. Big pill. Again, this is for a calf size, 500-600 pound calf. But think about this poor guy. Here's a normal size capsule that I might buy at the grocery store, or an herbal capsule, or some of the antibiotics come in this size capsule. This capsule may look this big to this little kitty. So we're trying to think in terms of little tiny capsules, little tiny tablets, and trying to do as make it as easy as we can on Squeaky. You can get these pillars from your veterinarian, and even pet stores will oftentimes have a little thing that helps you give pills. And what we're going to do is just take the pill that we're going to give Squeaky, and we're going to put it inside this delivery system. And then we're going to put this delivery system in Squeaky's mouth, and we're going to pop the pill after we get it in his mouth. I'm going to try to show you what we're trying to get over. See that hump in that tongue? There's a hump right there. So that we're trying to get over the top of that hump with this pill. The other thing that you may have noticed with that is that tongue is full of barbs. Cats have big barbs on their tongue, and so if we don't get the pill over the hump, it's going to get stuck on the front part of the hump. Those barbs and that hump will help him kick it right back out. So what we're going to try to do, we're going to have Fitz open the mouth, and I'm going to try to get this over the top of the tongue, and then we're going to deposit that pill back up over the top of the tongue like that. And then he's holding the mouth shut so that she will swallow it and not spit it back out. Yep, I think she got it. Yeah. So that was tablets, and as you see, they're not always the easiest to do. Another way is to use these liquid medications, and almost all medications now come in liquid format. A lot easier to do. We're going to try one of two ways to get this liquid into Kitty, into Squeaky here. We're going to open the mouth, and if she'll let me, I'll just squirt it right straight down the mouth. If not, and a lot of the older cats and bigger cats don't like to have their mouth open, don't want to have anything in their mouth, so you just pull a little bit of the gum line out here and squirt it in the side of the mouth like that. So let's see how we do here, Fitz.
All right.
I'm going to try this side approach right there, right in the side. There you go. All we did there, side of the mouth, we just pulled out a side like this and stuck it in like that.